Closed fracture. What is closed fracture? Closed fracture, also known as a basic or simple fracture, which means the skin is unbroken or it does not puncture the skin but the bone is fractured. Closed fractures are also dangerous and may still need surgery for a proper treatment. Even if you can't see any blood, the break will have caused something internal bleeding. You can tell that you have a closed fracture when you feel these symptoms. First, a sudden pain, trouble using or moving the injured area or nearby joints. Third, unable to bear weights, swelling, obvious deformity, and warm bruising or redness. There are several different issues that can lead to closed fractures. The most common cause of fractures is an injury from a fall, car accident, or sports injury. The majority of fractures heal in 6 to 8 weeks, while the hand and wrist fractures typically heal in 4 to 6 weeks. And if you are asking if the broken bone can heal itself, the answer is yes, because after a fracture, a blood clot will form around the break. Here are some examples of common fracture: broken wrist, hip fractures, ankle fractures, and spinal compression fractures.
Treatment for closed fractures may include splints, to prevent the injured limb from moving, braces, to give the bone support, plaster cast, to immobilize and support the bone.
Is Colles fracture? Colles fracture is a fracture of the distal end of the radius with backward displacement of the end. The fracture is sometimes referred to as a dinner fork deformity due to the shape of the resultant forearm. Tinatawag siyang dinner fork dahil kapag nagkakaroon tayo ng Colles fracture ay similar siya sa shape ng ating fork. So, what are the characteristics of the Colles fracture? First, we have the transverse fracture of the radius. Second, 1 inch or 2.54 cm proximal to the radiocarpal joint. Third, dorsal displacement and angulation, kung saan ang ating radius ay lalayo sa ating radiocarpal joint. And last, Colles fracture is common fracture in people with osteoporosis. Ang osteoporosis ay isang sakit sa buto kung saan ang mga buto ay nagiging mahina at marupok. Colles fracture occur in all age groups, although certain patterns follow all age distribution. First, in elderly. Because of the weaker cortex, the fracture is extra-articular. Kapag sinabi nating extra-articular, ang bali sa ating bone ay hindi umaabot sa joint. Next, in younger individuals, tend to a higher energy force to cause the feature and tend to have more complex intra-articular fractures. Ang intra-articular fractures ay bali sa ating bones kung saan umaabot sa ating joint. Ito ay mas malubha kumpara sa extra-articular fracture. And last, more common on women because of postmenopausal osteoporosis. After menopause, having less female hormone, estrogen is also makes a woman's boner thinner, that's why their bones weaken too.
Colles fracture. These injuries need prompt reduction, followed by splinting and casting with follow-up by an orthopedist to ensure proper healing. Severe injuries may require surgical repair.
Comminuted fracture. Fracturing the bones in which the bone is splinted or crushed. Comminuted fracture refers to a bone that is broken in at least 2 pieces. This fracture can affect any large or long bone in our body. One of the common parts of our body is the femur or the thigh. Some of the causes of comminuted fractures are car accidents, sports, injuries, and falls from a great height. And some of the symptoms of it is pain near the broken bones. Also, one of it is the swelling around the site of the broken bones or the break, bruising on the skin of the break, lack of sensation near the break, bruising of skin in the thighs, and many more.
Comminuted fracture. A comminuted fracture requires surgery to repair, usually with the addition of some hardware, rods, plates, screws, pins, wires, to put all those bone fragments back into their proper position and keep them in place while the bone heals. With severe injury, many people will be hospitalized for several days and require rehabilitation.
Another types of fracture is the compression fracture and path fracture. Compression fracture is caused by force from both ends as two vertebra. So this is our illustration. This is the spine of our back. This is the cold vertebra, the individual bones that it can form the spinal column. Example of compression fracture is if we are going to lifting a heavy object, of course yung vertebra natin is mafo-force yun. And pag na-force yun, magkakaroon ng break. Break of the vertebra. Ito, breaks. Pag nag-break yan, magkakaroon ng compression. That's the example of compression fracture. Another example is osteoporosis. Mostly, it's most common na nakikita sa mga matatanda. Because nag-weak na yung bones nila. So, kailangan nila ng calcium. Path fracture is the fracture at the distal end of the fibula with injury to the tibial joint. So this is the lateral view of our paa, of course. An example of path fracture is pag nasuot tayo ng heels and then matatapilok tayo, magkakaroon din ng sprain. Then yung sprain na yun is magkakaroon ng break dito sa end ng fibula. And it's called the path fracture. Another example is pag nag-landing ka sa floor. Volleyball, basketball, diba ganon? Mostly nakikita natin yan, diba? Sa volleyball and basketball. Pero, basketball, yun talaga ang sinasabi nga nila, injury. Sports injury. Basketball. So, pag nag-land ka sa floor at nagkamali ka sa pag-land, syempre, magkakaroon ka ng sprain. And dito na yan. Dito sa fibula. End ng fibula. Dito sa end ng fibula na to, ayun yung tinatawag na path fracture.
Compression fracture. Treatment of compression fractures may include medicine, rest, a back brace, or physical therapy. Sometimes, surgery is needed.
Path fracture. Treatment often includes wearing a cast, brace, or walking boot to stabilize the ankle and allow it to heal. Surgery may be needed in many cases. If you are experiencing the symptoms of an ankle fracture, it's suggested that you consult with a podiatrist.
Colles fracture. These injuries need prompt reduction, followed by splinting and casting with follow-up by an orthopedist to ensure proper healing. Severe injuries may require surgical repair.
Green stick fracture. A green stick fracture is when one side of bone is broken and other side is bent. A green stick fracture is a fracture in a young soft bone in which the bone bends and breaks. Green stick fractures occur most often during infancy and childhood when one's bone is soft and tender. It is when the bone bends and cracks instead of breaking completely into separate pieces. Fun fact: it is called green stick fracture because it is similar to what happens when you try to break a small green branch of a tree. And some causes of green stick fractures are vehicle collisions, sport injuries or non-accidental traumas, where a child or newborn baby was hit by an object.
Or treatment for green stick fracture. For the treatment, a green stick fracture requires immobilization and casting several days after the initial injury to decrease the risk of the need to recast due to the edema post-fracture.
Now we are gonna tackle about the impacted and the spiral fracture. So when we say impacted fracture, this refers to the bone fracture when the broken ends of a bone are driven into each other, causing a comprehension and often leading to a noticeable bump or swelling in the affected area of the bone. Impacted fractures can occur in the various bones of the body that are commonly seen in our wrist and in our hips. The treatment of the impacted fractures may involve immobilization with a cast or a splint, and in some cases, surgical intervention might be necessary to realign and stabilize the bone fragments. The exact treatment approach depends on a location and the severity of a fracture. So now, sa may spiral fracture naman po tayo. So, when we say spiral fracture, it is a type of bone fracture characterized by a twist or spiral-shaped break in the bone. This type of fracture typically occurs when a torsional or twisting force is applied to the bone. The twisting force causes the bone to fracture in a spiral pattern along its length. Spiral fracture can be more unstable compared to other types of fractures and may require careful management and treatment. So, ang spiral fracture, parang parehas lang siya sa impacted. Yung treatment niya parehas lang po sa siya impacted. Pero, spiral fracture often result from a significant amount of force or trauma. They should be evaluated and treated by the medical professionals to ensure proper healing and recovery. Kasi po pag spiral fracture is parang delikado na po siya kasi na-twist po yung bone natin, ganun po. Yun lang po.
Fracture. Break occurs at the angle across the bone. Usually, one fragment slips by the other. A fracture where the break is diagonal across the bone. So, ganito po siya.
Oblique fracture. The treatment for an oblique fracture usually involves immobilization with a cast or splint, pain relief, and, in some cases, surgery to realign the bones. It's essential to consult a healthcare professional for proper evaluation and treatment.
Open fracture. In this type, the broken bone tears the skin and may thus expose the bone to contamination. With an open fracture, there is a higher risk of infection. So, ganito po yung open fracture.
Open fracture. Treatment for an open fracture involves cleaning the wound, antibiotics to prevent infection, realigning the bones, and surgery to repair the injury, often followed by immobilization with a cast or external fixator. Immediate medical attention is crucial.
Transverse fractures, typically caused by a direct perpendicular force to the bone, like a heavy impact or fall. Transverse fractures can be more traumatic and may affect surrounding tissues, increasing the risk of complications. Fissure fractures. These are often stress fractures that result from repeated minor trauma or overuse. They can also occur due to conditions like osteoporosis. Fissure fractures are commonly found in athletes and may go unnoticed until they worsen, highlighting the importance of the early diagnosis and rest.
Transverse fractures usually require realignment and immobilization with casts or surgery if severely displaced. Fissure fractures, rest and activity modification are essential. In some cases, a brace or cast may be necessary.